Hi, I am Rosan Majalati Naval, a fourth year medical student of the Davao Medical School Foundation. Today, we're going to talk about the lens. So, this is the lens. This is the anterior portion, the posterior portion, the nucleus, the cortex, and the equator. So, the lens has three main parts: an elastic capsule. The capsule of the lens is an elastic basement membrane that envelopes the entire lens. It is thickest on the anterior and posterior surfaces close to the equator, measuring about 20 micrometers, and thinnest at the posterior pole, measuring about 3 micrometers. The inner surface of the anterior part of the capsule is in direct contact with the lens epithelium, while posteriorly it contacts the superficial lens fibrous cells. The thick basement membrane is formed by the lens epithelium anteriorly and by the superficial lens fibers posteriorly. It serves as a diffusion barrier and is freely permeable to low molecular weight compounds, but restricts the movement of large colloidal particles. The chief function of the capsule is to mold the shape of the lens in response to the pull of the zonular fibers during accommodation. The lens epithelium is cuboidal and lies beneath the capsule. It is found only on the anterior surface of the lens. At the equator, these cells elongate and form columnar cells, which become arranged in meridional rows. It is at the equator that the lens epithelial cells become transformed into lens fibers. At the equator, lens mitotic activity is at a maximum. The function of the lens epithelium is mainly twofold. The cells located at the equator are actively dividing and differentiating into lens cell fibers. The remaining, more centrally placed cells are involved in the transport of substances from the aqueous humor to the lens anterior, and in the secretion of the capsular material. The lens fibers constitute the main mass of the lens. The fibers are formed by the multiplication and differentiation of the lens epithelial cells at the equator. The lens cells elongates and turns meridionally. As basal part of the cell elongates, the process moves along the internal surface of the capsule. As the cell progressively elongates anteriorly, the nucleus moves anteriorly, so that it takes up a position anterior to the nuclei of superficial cells. This anterior movement of the nuclei as the fibers pass deeper produces the nuclear pattern known as the lens bow. What is presbyopia? In Greek, it translates to old eyes. Part of the natural aging process of the eye and can be easily corrected. It is a loss of the eye's ability to change its focus to see objects that are near. It generally starts to appear around age 40 and gets progressively worse until around your late 60s. Generally, it affects men and women equally. What are its symptoms? You need more light while reading, blurred vision at a normal reading distance, need to hold reading material at arm's length, headaches from doing closed work, and eye strain. What is its management? Eyeglasses, reading glasses, contact lenses, refractive surgery like LASIK or laser in situ keratomileusis. It is used to correct vision in people who are nearsighted, farsighted, or have astigmatism. PRK, photorefractive keratectomy. If you have high nearsightedness, farsightedness, and or astigmatism, it is a slightly shorter, simpler laser surgery that removes less corneal tissue than LASIK. SMILE, or a small incision lenticular extraction. It uses a very precise laser to create a disc-shaped piece of tissue inside the cornea that can be removed through a small incision. Lens replacement. Refractive lens exchange similar to cataract surgery. And corneal inlays. What is cataract? It is when your eye's natural lens becomes cloudy. Proteins in your lens break down and cause things to look blurry, hazy, or less colorful. What are its symptoms? Blurry vision, seeing double, being extra sensitive to light, having trouble seeing well at night, seeing bright colors as faded or yellow instead. What are its causes? It could be due to aging. Normal proteins in the lens start to break down at around age 40. Vision problems may not happen until years later. It could be hereditary, or if you have medical problems such as diabetes. If you smoke, if you have had a bad eye injury or eye surgery, radiation treatments on upper body, or you spent a lot of time in the sun without sunglasses, and chronic use of corticosteroids. What slows down its development? Protecting eyes from sunlight. Wear sunglasses, or you could wear regular glasses with anti-UV coating. How do you diagnose cataract? Slit lamp exam, retinal exam, and refraction and visual acuity test. Once diagnosed, what should you do? Have an eye exam every year if you're older than 65 or every 2 years if you're younger. Wearing sunglasses and a hat to protect eyes from UV light. If you smoke, quit. Use brighter lights for reading and other activities. A magnifying glass can also help. Limit driving at night once night vision, halos, or glare become problems. Take care of any other health problems, especially diabetes. Get the right eyeglasses or contact lenses to correct your vision. When it becomes too difficult to complete your regular activities, consider cataract surgery. What is the treatment? Surgery to replace the lens with an intraocular lens. These are my references. And that is the lens. Thank you.